So let me move through 10 myths about applied behavior analysis. One is that it's a one-size-fits-all approach. That couldn't be farther from the truth. Remember, it is intended to be individualized, to bring about individually meaningful behavior change. I had a student a year or two ago who said to me, Richard, I'd really like to go with you to work one day when you go see clients. I'd like to see what that's like. And my response was, if you came with me one day, you'd just see one day, right? And if you came with me to see 10 different clients and settings and contexts, you'd see 10 very different things, because I don't do the same thing everywhere that I go. It is very much individualized. So it's not a one-size-fits-all approach. Now it can be. You think, well, why is this a myth? Because if you do anything in a cookie-cutter fashion, that is a one-sized approach, right? So you could do cookie-cutter ABA. You can do cookie-cutter regular education or special education, you name it, right? So it's possible, but most of us know better. ABA teaches compliance and some basic skills, but not higher level skills such as play skills or social skills or more sophisticated skills. Two things I want to comment on there. One is the word compliance. We all understand what compliance means. It is the term that is used throughout the literature. I personally don't like the word compliance. I prefer to replace it with the synonym cooperation. And I've never met a parent or a teacher who would disagree with the idea that you want to have a cooperative learner, right? We like to work with cooperative students. But you have to be careful, because there is a legitimate concern that if you focus too much on cooperation, if you have too much compliance, you actually create a student, a child, a young person who's now actually at risk of being taken advantage of or abuse because they've just learned to do what they're told. And so it's increasingly recognized in behavior analytic circles that we have a responsibility to certainly have cooperative learners, because that reduces barriers and allows access to learning. But we have to balance that with students who can advocate for themselves, right? And advocate for and have their own autonomy and protect themselves where needed. And the ability to say no and I don't want to do that, right? Not just kind of robotically go along with things. That could happen, but we're very sensitive to making sure that doesn't happen. Then the other half of this is about it's just superficial. You can just teach basic skills. That's certainly not the case. There is a ton of literature on teaching a wide range of social skills to a wide age range of learners. I have used ABA methodologies to teach algebra to high school students. Now, that's not my particular area of strength, doing the algebra, but we have very effective programs for things like algebra and calculus, even at the university level. One of my favorite courses when I was an undergraduate student in psychology is I took a psychology course that was offered through a methodology called Personalized System of Instruction, PSI, which is a mastery-based, scripted, self-paced course. And it is a behavior analytically designed course. It is university instruction designed with ABA, and I achieved a very high grade in that course because it's designed to teach students to competency. You should get a high grade. But more importantly, I can remember more from that one course as an undergrad than pretty much any other courses that I took because of the design, right? And that's higher level university content. ABA results in similar outcomes for all kids with autism. That's not the case. That's far from the case. Many of you are probably familiar with one of the earliest studies of early intensive behavioral intervention that kind of got the whole thing going. That's really one of the earliest impetuses for why there was the class action lawsuit in British Columbia, where families in a class action suit sued the government for early intensive behavioral intervention. The funding that we have in our province is the result of families seeking ABA services that were early intensive behavioral interventions. And that all goes back to Lovaas 1987, where he published this famous study where 47% of his experimental group, kids who were diagnosed with autism around 3 or 4, had 2 or 3 years of intensive ABA, 40 hours a week, and 47% of those students lost their diagnosis, went off into grade 1 or kindergarten, not identified on the spectrum, not receiving special education services. And that was a paradigm shift. That changed everything, because before that, people didn't think that students with autism were capable of achieving those types of learning outcomes. So that changed everything. But it's also important to recognize, people look at that data and go, well, 47%, well, that's about half, right? What about the other 53%? There's a significant number of the other 53% who made significant gains that they wouldn't have had without the intensive intervention, but they didn't achieve those optimal outcomes, that famous 47%. And you have to be very careful not to overgeneralize that everyone is capable of achieving that. But there's also a small, single-digit percentage of those kids who still got the same treatment. They had the same intensity for the same duration, and they didn't make those appreciable gains. So there's a lot that we don't know that remain empirical questions, right? We can't predict when I meet a student what their outcome will be. It's possible to have an optimal outcome that it's hard to even imagine how good it can be, or it can be much, much more modest and some variation in between. We can't predict. It would be unethical to actually speculate what outcome a student will achieve. Although we do know there are certain things that are predictive of success, both in terms of what the student brings to the table and what the program brings to the table. Things like if the student already has a measurably high IQ, that's a good prognostic indicator. The stronger their language is a good prognostic indicator. If they can already imitate, or if they can acquire imitation quickly, is a strong prognostic indicator, as well as the ability to be receptive to and responsive to social reinforcers is predictive of outcome. Not a guarantee, but just associated with kids who tend to do better. And less stereotypy, engaging in repetitive behaviors. In terms of things that predict on the program side that predict success, it will be the intensity of the intervention, the amount of supervision of the intervention, right? Having a lot of hours of therapy without a corresponding percentage of oversight for implementation fidelity is problematic. You need to have both, right? So there are some things we can do to predict, but it remains true that we have this heterogeneity of outcomes. We have a wide range of outcomes. There is evidence that other treatments or methods are just as effective. Simply not true. As I mentioned earlier with the NAC report, there are a number of things that are emerging and have potential, but the most evidence-based tactics are predominantly behavior analytic or behavior analytic in nature, or derivative technologies of behavior analysis. An intensive ABA program is a guarantee that a child will be able to enter kindergarten without supports. This probably goes back to what I just said about that Lovaas study, 1987, where famously 47% actually achieve that outcome. That is not the case, that 47% will in the real world achieve that outcome. Right? And again, we would never predict meeting a child in preschool whether that will be their outcome. I've worked with lots of kids who have had less intensive supports over time as they continue to progress. And we don't look at it as a sprint to kindergarten, but as a long-term marathon. Intensive ABA is no longer justified when children are past preschool. This goes back to the idea, people think of the origins of ABA for autism was early intensive behavioral intervention. It was working with the preschoolers, but it doesn't stop at preschool. As I've described from my own clinical experiences, I've worked with kids who had that early intervention and continue to have it throughout their elementary school years and into high school and sometimes beyond. They continue to benefit because it just makes sense. You'd continue to benefit from effective instruction. The targets that you're working on, your goals will shift, and they should, across the lifespan. If a child has not met all of their preschool milestones before kindergarten, it might make sense for a while to keep working on those, but if you're still working on those things when the child is now in grade 4 and grade 8 and grade 11, there's probably a problem of focus, right? You should adapt with the current needs. ABA is mostly compliance training, leading to students who are resistant to and escape motivated. As I said earlier, I've already talked about the problem of the word compliance. And this was true early on. I remember this in my first job, where my job was to go in and get Johnny to sit down and look at me. And the idea was that these are cooperation behaviors that allow him to then be responsive to instructional tactics. Right? We don't do that anymore, have just artificially kind of sit and look at me. There are certainly limitations and problems with that. So that, I think, lingering myth continues. And you get students who are resistant and escape motivated. ABA is teaching, right? An ABA program for kids with autism is a teaching program. A teaching program done poorly can absolutely lead to kids who are resistant to being there and escape motivated. I can remember when my two sisters were in elementary school and they had piano lessons, and their piano lessons led to this outcome. They were resistant to their piano lessons and they were escape motivated. And that was really just because they had bad piano lessons. But do you throw all piano lessons out because of that? No, you recognize this one instructor, this one piano teacher wasn't particularly well suited to work with them. Get a different piano teacher and then things can be better. So really teaching anything can be done badly and result in people who don't want to be in that instructional setting. ABA employs a lot of punishment? No, we don't. Was it part of the past? Absolutely. In the 70s and 80s, unfortunately, it was. Although also in the 70s and 80s, parents were much more likely to spank their children, to be told by their pediatrician it's okay to spank their children. Principals and school staff were using the strap and physically punishing children. It was more an artifact of the time in society. Contemporary applied behavior analysis avoids the use of punishment wherever possible. as I mentioned earlier, I teach ethics across a number of universities. So I'm very in tune with the ethics code. And we have a number of clear professional and ethical compliance code items that address punishment and that have safeguards in place before you'd ever consider punishment, in particular consents, and making sure you've exhausted non-punitive strategies before you use punishment. So that is a legacy notion that punishment is commonly used. No longer true. ABA is limited to a few strategies, mostly discrete trial teaching. I think I've already dispelled that notion. And all professionals are created equal and all explain ABA in the same way. Absolutely not. No two professionals are the same. You will meet a medical doctor who you like and a medical doctor who you don't like, and a dentist, and so on and so forth. Same with behavior analysis. If you've had one bad interaction with ABA and a professional, don't chalk up the whole field to that. Don't associate the whole field with that, right? Try somebody else. We are unique individuals, and you will have a good fit with some and maybe not a good fit with others. And the other thing I wanted to comment about here is the idea of explaining ABA in the same way. Absolutely not true. I'm explaining a lot of ABA to you right now in a particular way that I've come to adopt, but I know there are some of my colleagues perhaps watching this going, oh, interesting, I would have said that differently, and that's okay.